Get that in progress here. All right. Well, welcome everyone to the first session for Grants 101. We're really excited at the Office of Research and Innovation to talk to you about grants. We love grants. And so we're going to talk to you about the first step, which is how do you find money? We'll be covering in later series, how do you actually put together those applications and then manage those awards? But you might be just wondering where to start. So to give you kind of an overview of what we're going to be covering today, we're going to basically talk about how do you navigate the federal grant space. The beauty of the federal government is it's all public, but it's not easy to find. So I'm going to talk through some of the major players that we've seen, and also give you some helpful tools and show you how to search for the federal grants, both research, programs, conference, whatever you're interested in. We'll also look at identifying nonprofits or non-federal funders, a trickier area because they're less centralized in one place, but I'll give you some pointers there as well. And then finally covering some tools, both for finding federal grants and for finding non-federal grants. All right, so just before we get into actually what to search for, you're gonna see a lot of terms come up. And you're going to wonder, what is all this alphabet soup? And if you've done grants before, some of these may be familiar. These are a lot of terms, and a lot of them actually are different words for the same thing, which is what is the first slide here. These are all terms for a funding opportunity. So notice of funding opportunity, request for applications, program announcement, call for applications or proposals, they all mean the same thing. A funder has a pot of money with some specific guidelines, and they want to have people apply for it. And they're usually competitive. If they're not, they usually say like it's by invitation only. But they all mean the same thing. So going forward, I'm going to probably just talk generally about an opportunity, but sometimes you'll hear people call it an RFP or a call or just a notice. They're all the same words. So use whatever you're familiar with, but just letting you know what I'll be using. And then some other terms that you'll see as you're like looking through opportunities to wonder what are these things? So a letter of intent, this is usually briefer application. Sometimes it's just a Word document that's a couple of pages long. That is stating your intent to apply. And it usually outlines generally what your research is looking like or what the program you want to fund is, and you send it. And they request it usually for two reasons. It's because they're trying to winnow down the field of potential applications to a select few, or sometimes is often the case, especially for federal grants, they require a letter of intent just to know how many reviewers they need, and what kind of subject area they will need to have those reviewers have. So they don't recruit a bunch of geographers and realize they need mathematicians. A cooperative agreement. This is different from a grant, and you'll see some people call them not grants but cooperative agreements. The difference between a grant and a cooperative agreement is a grant is somebody just giving you money to do a thing based on your proposal. A cooperative agreement is just that it's cooperative, meaning you have certain expectations that you'll have said what you're going to do in your application, and then you're also going to have the funder have some sort of application role in that as well, whether it's participating, providing technical assistance, helping with performance measurement. So it really is, you're both doing something, whereas a grant, typically you're just doing one. You'll typically see cooperative agreements only at the federal level, and only really in certain agencies that do cooperative agreements. Project director or principal investigator, that's you if you're applying. They're used interchangeably. Sometimes you will have multiple principal investigators or co-investigators, but these are the people who are leading the grant. These are the point person and ultimately the person that is responsible for making sure everything that you said in the proposal is done and that you follow all of your funders' rules. And then finally, you might see what's called an NOA or Notice of Award. This is basically letting you know that you got an award, that you've been funded. And that's usually typically a federal term. Funders are a little bit more casual in the nonprofit side because They have less rules around what they need to call things, but you'll typically receive an NOA. And that's all the terms for what you have to do. All right, so I covered the alphabet soup. I missed one more. This is the project officer or program officer. This is the person on your funder side, so the people you're applying for. This is the person who will answer any questions you have, is responsible for overseeing the grant process, and is probably the person you're going to be talking to a lot if you are funded. But they're called the same thing, used interchangeably across agencies, federal and non-federal. All right, so that's the alphabet soup, and let's move into a different alphabet soup, the federal government. These are by no means all of the federal funders. Like, you will notice organizations such as the Food and Drug Administration, US Department of Ag, EPA are not on this list, mainly because they don't always give out as many grant opportunities that you can just apply for. They're either for states or invite-only opportunities. But these are the ones we've seen in the Office of Research that are generally good ones to go for, particularly for people in health sciences. So the first is the Agency for Healthcare Research and Quality. You may or may not have heard of this one. It's a very small agency, but they're very focused around how can you improve patient quality care. They want you to do that by trying and developing new methods for improving patient safety, using data and technology to improve outcomes, including developing new technologies, especially interested in telehealth. And then finally, research in and around the economics of healthcare, and particularly market-based approaches for healthcare. And I'm going to go through these fast, but there will be some links here at the end that if you want to go in and read more about any of these agencies, you certainly can. The Center for Disease Control and Prevention, probably an organization everyone has heard, certainly after COVID, is the nation's public health agency. I will say that the word centers is important because there are actually, I think when I counted, there were over 28 different organizations kind of under the parent umbrella of CDC. And broadly, what they are interested in is funding research to prevent and respond to health threats, and also doing programs, whether that be programs for funding treatment of opioid use disorder, occupational safety, vaccine promotion. It's really a broad landscape that they try to fund, and they go the gamut from prevention of both infectious and non-infectious to surveillance of diseases. The Education and Training Administration is an agency under the US Department of Labor. They're a very broad agency. So when you hear people talking about unemployment insurance, job relocation services, trade adjustment assistance, they're the agency that does all of that. In addition, they also fund a lot of programs to promote state and local workforce development. So if you've heard of apprenticeship programs, this is the agency that is pushing those and funding those. They really want to promote high quality jobs. And if you're wondering what the heck does high quality jobs mean, it's very nebulous. But in general, they want people to be going towards a job that is fulfilling, rewarding, can pay for their costs, and they generally want people to go for and get more skills and really try to, in their words, achieve the American dream. It's very broad and high-minded, but really what they're interested in is getting people more skills, especially moving from unskilled or unemployed individuals to skilled individuals with good jobs. They usually also, just as a note, require partnerships with employers and state governments. So a thing to think about just as you're going forward. The Health Resources and Services Administration, or HRSA, is also in the space of healthcare, both in providing funding for services and also in workforce. They have a lot of programs around AIDS and HIV prevention, access for low-income healthcare. If you've heard of federally qualified health centers, HRSA is the agency that oversees them. And they also do a lot of workforce development programs. If you're familiar with South Dakota's Area Health Education Center program, That's the agency that funds it. They also do a lot of other things in regards to loan forgiveness that you're not going to necessarily apply for. But their goal is basically to increase access to healthcare services through a broad variety of services. And they're really interested at growing that workforce and the infrastructure needed to do that. The National Institutes of Health, probably another organization you've heard of. They are, again, like CDC, a parent organization with, I believe, 27 different institutes underneath, institutes and centers. And they're focused largely on health research, and they want to protect and improve the health of citizens of the United States. They offer a variety of funding for researchers at all stages of their career. This includes people pre-doctoral to experienced researchers with 20 years of experience. And they also fund a variety of programs, from whether you want to do engagement research, conferences, you're looking for clinical trials or non-clinical trials, or you're looking to do secondary data analysis. They have a lot of different pathways all around their different institutes, which range from drug and alcohol abuse to environmental health to minority health disparities. There's a broad variety that NIH hits. The National Science Foundation, also a largely research organization, not exclusively focused on health, but they do have several directorates. They're split up into 8 directorates that are focused on health-related programs. There are the directorates of health and director of social services and directorate of education and human resources. But again, they fund a whole broad gamut from mathematics, computer science, and social sciences. The Patient-Centered Outcomes Research Institute. They're focused around clinical effectiveness research. So looking at different treatment options, different ways of engaging with patients. How can we make better outcomes for patients and really put patients at the center of the conversation, both in making decisions about their healthcare, but also as in what makes quality healthcare. They also fund engagement, dissemination, and implementation activities. PCORI is a new organization, and they are not a federal agency, but they are federally authorized and funded. So they're a weird organization where they're actually a nonprofit, but all of their funding comes from Congress, and they were recently established in 2010. So they're the newest agency actually here on the list. Then we also have SAMHSA, the Substance Abuse Mental Health Services Administration. They are focused on behavioral health, both in providing services and providing training. They also inherited a program from, I don't remember where they inherited it, but they're also interested in emergency medical services, particularly in growing the EMS workforce. So if you're thinking mental health, behavioral health, and you're thinking more program side, SAMHSA is a way to go to if you don't find what you're looking for your idea for funding in something like NIH or NSF. And now you're like, oh, Nathaniel, you went through all of those links. Now I have to go and navigate all of these different websites. I have great news for you. You absolutely do not. We'll be sharing the slides out at the end. All of these links here will go to the sites and explicitly their open opportunities page. So if you're wondering, what kind of funding does AHRQ have? You can click on it. It will pull up their available notices of funding. And we'll send this out afterwards so you can have a look at it and use them whenever you need and for reference later. But now I'm going to actually show you, if you want to just search everything, so you don't want to have to go to all of these resources, where do you go? The nice thing about federal government is they have what's called Grants.Gov. And it's a great website. It's not the hardest to easiest to navigate, but I'll kind of walk you through searching for a program quick. So we're just going to go here to search grants, and this pulls all of the opportunities that are open or forecasted. Forecasted means it's not official. They have saying that they're hoping to fund for this opportunity, but it's not open for applications yet. You can also look at previous opportunities that are closed or archived. Archived are just older opportunities. So now let's look and say, okay, I'm interested in CDC grants. And I want to see what everything the CDC has, because you'll notice on that last slide that I showed, CDC was not one of the links because they don't have a central website. So you have to go to under the agency, find Center for Disease Control, and then find the specific center. And we can click on it and it will filter down. So this is one I had previously looked up from the National Center for Injury Prevention. So I can see here all of the opportunities that that center has when they were posted and if they're open. And it looks like there's actually only one that's open. So let's go click on that. And now this tells me a bunch of information. I can see if we're eligible. I can see what the purpose is, and I can also see related documents. And this is where you'll find all of the instructions for applying. And if you have any questions as you're doing this, feel free to reach out to Ori. We're always here to help. We've spent a lot of time in this grant space, spent on Grants.Gov, and we want to help you be successful in your grant endeavors. So I'm going to go back just to the general search now and do another search, because say I'm interested in mental health and I want to know just everything out there on mental health. I can search and see, oh, wow, that's almost over 1,000 results. I don't have time to do that. So I go and see, I work for USD. So let's do public and state controlled institutes of higher education. That's half of them. And I want to look for grants that are specifically related to housing for mental health. Now I can see different ones to see if there are any opportunities. I don't see any opportunities, but I can go through and look at different things. I can filter it by health. I can add additional keywords, like say I want to say mental health training. That narrows it down. And unfortunately, every time you do a search, it resets everything. So you have to go and change things up. But you can kind of see generally how to search for Grants.Gov. And again, just a reminder, Ori's here to help whatever way we can. All right, so I'm going to go back to my slides here. Okay. Just pull up. And if you have any questions while I'm going through this, feel free to put them in the chat and I will try and answer them either in the moment or as soon as I notice them. But we'll move on to non-federal. So this is harder because there is no Grants.Gov, or at least no free Grants.Gov. So what we've done is we've pulled together some resources for how some organizations that are specifically interested in funding funding health programs, health research, or just programs in South Dakota or specifically Vermilion. This is by no means everything, but it's a general start and some good ones to reach out to. So let's go first to the Polaris Foundation. Polaris, most notably known for their all-terrain vehicles. They have a warehouse in Vermilion. So if you're looking for a project located in Vermilion, they like to invest in company communities, Vermilion specifically. The nice thing about private funders or non-federal funders is they tell you exactly the kinds of things they want to fund without saying this is how you have to do it, which can sometimes be an issue with federal grants. But they fund things related to youth safety, community development, environment and land access, and diversity and inclusion. So if you're doing a program that's in Vermilion or that is centered around the Vermilion community, definitely a program to be interested in. The Hearst Foundation is a nationwide nonprofit. You'll see them called foundations. It's just a weird quirk. They're just one organization. that funds work in culture, education, health, and social services. Their priorities include funding professional development opportunities for healthcare professionals, improving healthcare access, specialized care to elderly populations, providing intensive behavioral health care, um, and research to find cures and treatment for diseases. They're very much more research focused instead of program. So if you feel like your idea might fit in, the Hearst Foundation is someone to reach out to. Um, Also, a hint, just as I'm thinking about this, if you're talking to nonprofit organizations, um, once you have an idea and you think it might be a fit, it's always a good idea to email their contact person and say, this is generally what my plan is, because then they can tell you whether or not that's a good fit. It will save you a little bit of time, and you start building a relationship, which nonprofit funders like to do. They like to build relationships. So it's a little less distant and removed than federal government. So if you ever have a question about whether it's a fit or not, feel free to reach out, or we at the Office of Research can do that for you as well. Another potential opportunity or partner is the South Dakota Community Foundation. Um, they are, again, focused on investing in communities around a whole array of projects from culture to economic development, education, financial literacy, and health and human services. Um, they're generally smaller projects and usually not research. Um, and they also require you to usually have funding coming in from other sources too, whether that be some resources that you're getting from another grant, or if you have a donation from someone else. Um, they require you to provide some stake when you're applying. The Bush Foundation is similar to the Community Foundation, focused on those community solve-oriented problems. They're focused exclusively in our region, so North Dakota, South Dakota, Minnesota, and the 23 Native nations that share the same geography. Again, they're more focused on programs and less on research, but they are very flexible about the types of projects they're willing to fund. But if you have a question of like, is what I'm thinking what they're interested in funding, feel free to always reach out. Also is the Medica Foundation. So Medica is an insurance provider, but they're specifically interested in projects around improving health outcomes in their service regions. So North Dakota, South Dakota, Minnesota, parts of Iowa and Nebraska. So if you're looking specifically at projects in South Dakota, they are very interested in funding, and they include areas of behavioral health, early childhood health, and rural health. They also have a larger opportunity for strategic initiatives, but they usually only give those to people they have funded before under the 3 areas that I mentioned. But those are also much larger grants. And then finally is the Robert Wood Johnson Foundation, another nationwide nonprofit focused on health equity. And they have a lot of different grants, from fellowships to research grants to improving services, all around health systems, healthy communities, healthy children and families, and leadership for better health. They fund a wide variety of things. They're always posting new opportunities throughout the year. So it never hurts, especially for a lot of these organizations. If you're interested, but you don't see any opportunities now, to sign up for a newsletter. Frequently, opportunities are included in that. Or you can just keep checking all of these links. They work just like the federal ones, take you directly to their opportunity page. You can learn more about what they have open, their application requirements, program contact information, anything you want to know. And lastly, I'm going to share with you another resource, which is us, the Office of Research and Innovation. We frequently do a lot of grant searches for faculty and staff. We have a forum. So if you don't have time to do all of this, or you're like, I'm busy with classes, midterms are done, I have 25 papers to grade in the next 3 days, but I'm thinking about doing a grant, I don't have time to do this, that's what we're here for, to help. So we have this form here, and this will be in the slides, and I'll also send it out in the email too. If the link doesn't work, sometimes there's problems with clicking on it and it'll take you to an error. Just copy and paste it into whatever browser works for you. And just fill it out: name, email address, what kind of request you're looking for, research, something leading to an academic publication or programmatic or service, whether that's a training program or a conference, whatever you're interested in, just select it or just put other. And then give us some information about what you're looking for, whether that's a research question, a program design, maybe a link to an article for something that you were like, this is great, we need this in South Dakota or the USD. Anything that could help us give you some good opportunities to apply for funding. All right, so I've been talking for almost a half hour now. I'm going to stop sharing and turn it over to you all to see if you have any questions. If you want me to go to any of these specific sites, just let me know. But I'll turn it over to you to ask, see if you have any questions. So Clara, does Grants.Gov show past grants or grants that are closed? So I can have an idea if they plan on going to the grant again in the future. Yes. So if you go to Grants.Gov, and I can actually just go back there. If you go to Grants.Gov, you'll see what's called opportunity status. You can look at close. So if I want to see all of the previous opportunities they had for mental health training for public and private state-controlled institutes of higher education, I can see who was funding, when they funded it, and learn anything more about it. I can go back in and I can read the previous instructions. It generally gives you a decent idea, but frequently the federal government will either only do a one-off for an application, or if it's a continuing thing, oftentimes if it's comes up only every 5 years, they'll change because they've learned something or the agency has changed in 5 years or the priorities have shifted to focusing on a different topic. But it will give you a general idea of what is out there. The closed are the most frequent. So I think usually in the last 6 months, archived will go back, I want to say 3 years, actually even longer. We'll see some from like 2010. So if you want to see everything, you certainly can, but it might quickly end up being a lot to look through. But a good question. Anything else? All right. I'm going to give everybody just a couple more minutes to think if they have any other questions before I stop the meeting and recording. But just give you a spiel about the Office of Research. Again, we're here to help in whatever way we can with helping you find grants, apply for grants, and manage them post-award. We've done grant searches. We're helping faculty implement programs, apply for grants. So if you have any questions, feel free to reach out. Our email is ori@usd.edu. I'll also be emailing you after this with the slides and a link to the recording, as well as a survey to please fill out. We like to get some ideas for what future Grants 101 training should look like. Things you're like, I would like to learn more about this topic. Please feel free to reach out. We're happy to help in whatever way we can. And I don't see any other questions. So I'm going to stop recording here. And thank you all for coming today.